Hello guys, welcome to our short series. Today we are going to discuss about the malaria overview. In this, we are going to cover the treatment protocol, indicators, and how to differentiate the malaria species from the peripheral blood smears. So let's start our discussion. Before we proceed to the discussion, please do subscribe and share with your friends. Let's start our discussion with the malaria life cycle. Here you can see the Anopheles mosquito. It is your definitive host of the Plasmodium species, and your human body is the intermediate host of the Plasmodium species. And when you see the definitive host, it will carry the sexual stage of the Plasmodium, and intermediate will facilitate for the asexual stage of the Plasmodium species. So when the Anopheles mosquito bite through the circulation, the sporozoites is released into your blood circulation. It will reach the pre-erythrocytic stage of the hepatic stage. In this, the more and more virozoites will be formed. This is also known as the cyjoint. And some of the species like Plasmodium vivax and Plasmodium ovale, which will carry the hypnozoites. This is a dormant infection which will cause the relapse of the malaria. And next, when there is a rupture of the cyjoints, which will release the more and more virozoites, and it will reach the erythrocytic stage of the malaria. And this will cause the symptoms. Clinical symptoms will be seen in the asexual stage or the erythrocytic stage of the Plasmodium species. And this will be manifested as a chills and fever and headache. All the symptoms will be seen when there is a rupture of the RBCs in the blood circulation. So more and more cyjoints will be released, more and more cyjoints rupture, which will cause the virozoites, and the cycle will be continuous as a vicious cycle in the malaria. And some of the tropozoites, when they are transformed, will be carrying the gametophytes. Again, when there is a bite of the mosquito, which will carry the asexual stage too, and again the cycle will be continuous. So this is the malaria life cycle. So next, moving on to the Plasmodium species. We have the 4 different species of the Plasmodium. One is the Plasmodium malariae, which is also known as a quartan fever. Why this is known as a quartan fever? The cycle fever is 72 hours. And next, coming to the Plasmodium vivax and Plasmodium ovale. Why this together compared means the 48 hours of the fever, which will be known as the tertian, and this is also seen as the hypnozoites, and high chance this can be having the relapse of the Plasmodium and malaria in the human. And next, coming to the Plasmodium falciparum, which is the most common form and which is the most severe form, and it will be seen in the RBCs of the old RBCs can affected, and also it will be affected the new RBCs. That's why there is a high chance of the brain, cerebral malaria, and kidneys and lungs. All the RBCs can be affected by the Plasmodium falciparum. Next, coming to the diagnosis by the peripheral blood smear. What is the specific thing that we have to know in the Plasmodium species? This will be affected by the RBCs, right? Erythrocytic cycle will be affected. How can we diagnose? With the tropocytes, tropocyte ring. Here you can see this is the tropocyte, and when there is a ring inside the RBC, this is known as the Plasmodium malariae species. Next, coming to the Plasmodium vivax and ovale, here you can see there is a ring-like form, small granules inside the RBC, which is also known as the Schaffner stiffling of the RBC. Next, coming to the Plasmodium falciparum, here you can see this is a banana shape or the headphone shaped RBC, which will be only specifically seen as the Plasmodium falciparum. So this is your Plasmodium malariae, this is your Plasmodium vivax and the Plasmodium ovale, and this is your Plasmodium falciparum. Next, moving on to the other findings, stippling and the dots, very specific to the each and every type of the Plasmodium species. When it comes to the Plasmodium vivax, we will be seeing in the RBC Schaffner dots. And next, coming to the ovale, we will be seeing the specific findings like dark brown crystals. These are known as the James dots. And next, coming to the Plasmodium malaria, this is known as the G-Mens dot. And in this G-Men dots, you will be seeing these kind of the rings, and they will be only the light brown color, which is associated with the Plasmodium malaria. Next, coming to the Plasmodium falciparum, here you can see these are the kind of rings will be seeing thin, delicate rings inside the RBC, that is known as your Morier dots. So these is the things that you can remember. When you see the Plasmodium vivax, you will be seeing the Schaffner dots. When you see the Plasmodium ovale, James dots with the dark brown color, and the Plasmodium malariae, G-Mens dot, which is the light brown in color. And next, the Plasmodium falciparum, which is the most common type, you will be seeing the Maurer clumps. Next, moving on to the Plasmodium vivax treatment problem. So always remember, the Plasmodium vivax is going to affect your only new RBC only. High chance of the relapse. Why there is a high chance of the relapse? Due to the hypnozoites in the dormant stage of the liver. So in all the states, the Plasmodium vivax, whether it's northeastern or the western, north, south, every region, the same protocol will be followed. What is the drug of the choice for the Plasmodium vivax? That is your chloroquine, 25 mg per kg that is given. How this is given, the dose and course will be, the day 1 you are going to give the 10 mg per kg, day 2 will be the same 10 mg per kg, and the day 3 you are only going to give the 5 mg per kg. Only the 3-day course is given for the Plasmodium vivax as the drug of the choice with the chloroquine. Next, moving on to the relapse, there is a high chance of the relapse. So that's why to prevent the relapse, we are going to give the prophylaxis of the primaquine, 0.25 mg per kg per day up to 14 days. So there is a high chance of the relapse due to hypnozymes. To kill these hypnozymes, we are going to provide the primaquine as a drug of the choice for the Plasmodium vivax. But there is a question that primaquine is the contraindicated in which of the following patients? One is your infants, is completely opposite. We are not going to give. And in the G6PD patients, we are not going to provide the primaquine, and also in the pregnancy patients. So this drug is completely contraindicated. Next, moving on to the Plasmodium falciparum. Plasmodium falciparum can affect the old RBC and also new RBC. High chances of the severe malaria, and this is also the most common type of the malaria all over the world. And it can cause the cerebral malaria, multi-organ failure. But remember that there is no hypnozoids or there is no relapse of the Plasmodium falciparum. So, but what is the treatment protocol? So, there is a high resistance in the northeastern states due to the highly prevalence of the Plasmodium falciparum. So, for that, to remove this resistance, high chances to decrease the mortality, what we are going to use is the ACT-AL therapy for the first 3. ACT means we are going to provide the artesunate and also the artemether and the lumefantrine. So these are the 3 drug therapy we are going to give. On the first day, we are going to give the artesunate, artemether and the lumefantrine on day 1, and the next 2 days we are only going to give the artesunate, but artemether is not given and also lumefantrine is not given. Next, on the second day only, on the day 2 only, the 0.75 mg per kg is given as a primaquine on the day 2. But even though there is no relapse of the hypnozymes due to other resistance, other type of the ovale, malaria, novel C, these kind of species also present. So that's why to prevent that, primaquine is added only for the day 2. Next, coming to the other states, remaining any states, what we are going to follow? Only the ACT-SP therapy. In this, instead of the artemether and the lumefantrine, we are going to provide the sulfadoxine and the pyrimethamine as a conjunctive therapy for the Plasmodium falciparum. On the day 2, we are going to give the primaquine 0.75 mg on day 2 of the Plasmodium falciparum in the remaining states. So next, moving on to the Plasmodium falciparum in the pregnancy. Remember that primaquine is contraindicated. Whether it's vivax or the falciparum, primaquine is completely contraindicated in the first trimester and the second trimester. So coming to the falciparum, artesunate therapy is not given in the first trimester. In the first trimester, your drug of the choice is quinine. So this is only given. But in the second and the third trimester, you can go for the ACT and the AL therapy for the patients, depends on their state. And next, Plasmodium vivax, as the primaquine is contraindicated, we can go for the chloroquine as a drug of the choice for the first 3 days therapy in the vivax. Next, malaria prophylaxis. This is also commonly asked question. Again, when you are going to travel in these endemic regions in the northwestern areas, what is this malaria prophylaxis? When you are planning your trip only the less than 6 weeks, then you can take the doxycycline as your drug of the choice, 100 mg per daily, 1 to 2 days or the 2 to 3 days before the travel you have to take. And how long you have to continue? Until the post travel, 4 weeks after also you should keep on taking the doxycycline 100 mg per daily for next 4 weeks. Should you also continue during your travel? Yes, it has to be continued even during your travel. And next, coming to the long term, which is a more than 6 weeks, then we can go for the mefloquine, this which is given only weekly once, that is 250 mg mefloquine tablets. So this is also started 2 to 3 weeks before the travel, continued until 4 weeks after the travel, and it is also given throughout the travel period. So this is the Plasmodium prophylaxis. Indicators of the malaria and what is their description. Here you can see the annual parasite incidence. What is the importance of the annual parasite incidence? This is going to correct your malaria impact indicator. The annual blood examination rate. In this, it is going to check for the indicator for the prevalence of the fever. Malaria fever prevalence is going to find out. malaria prevalence fever is going to find out by the annual blood examination, right? And it is also an operational indicator. Next, coming to the slide positivity rate. In this, we are going to check the outbreak of the indicator in the depends on the endemic or the epidemic regions. Infant parasite rate, this is going to check for your recent transmission indicator in the malaria in your community. So what are the types of the indicators and what is their importance in the prevalence and the calculation in the community indicators? So remember that high yield topics and previous year topics is very important. In that, if you consider the malaria is one of the most important topic for your examination. Coming to the therapy, life cycle and indicators, this is highly recommended for your SPM exam. So please do subscribe to our YouTube channel, and for more content and the videos, for daily updates of the flashcards, notes and revision notes, please do join the Telegram channel and the WhatsApp group.